Hello friends, I am Dr. Nishtha Dalwani, consultant psychiatrist and psychotherapist practicing in Mumbai. Today, I wish to address a very critical issue that needs our immediate attention: the rising rate of suicide amongst our youngsters. Depression and mental health illnesses is on the rise. In the current mental health scenario in India, we face a dual challenge of lack of awareness of mental health illnesses and the stigma attached to mental health illnesses. We must encourage open dialogue and create spaces where individuals feel free to express their mental health struggles without the fear of being judged. Suicide rate among the youngsters, so in the age group of 18 to 30 years, is on the rise with an average of 38 per lakh population. It is the commonest cause of death in the young people. It is 2.5 times higher in Indian men as compared to the women. World Suicide Prevention Day is observed on September 10th every year to raise the awareness of suicide. The theme for 2021-23 was Creating Hope Through Action, which promotes the initiative to take action and create hope for those having suicidal thoughts. A 17-year-old girl studying in 12th standard came to the casualty of my hospital with deliberate self-harm. She had cut her wrist superficially with a blade as her boyfriend was seeing someone else. Her parents were going through a divorce. Her mother, a doctor, wanted her to pursue medicine and had asked her to give the NEET exam. But the girl was not interested in medicine. She was going through career confusion. In the recent times, I have seen complex psychopathology among teenagers. The triggers for suicide are lack of self-identity, career confusion, long working hours, rapid social change leading to poor emotional connect with our loved ones, preoccupation with gadgets, so mobile and internet addiction, breakup of relationships, the fear of that I'm not looking good, so low self-esteem, and lack of play. In the current scenario of nuclear families, extended family support from grandparents, uncles and aunts is lacking. Also, with the online mode of studies and working which we are seeing following COVID, the poor social contact, spending more time with gadgets, gaming and the bad influence of social media is quite evident. Now, the precipitating factor for suicide could be a negative life event like a breakup or a divorce, loss of a loved one, any negative interaction or an argument, a physical illness, unemployment, financial problems, any illicit relationship or pregnancy, sexual abuse and drug intoxication. Men use firearms, hanging or jumping as a mode of suicide, whereas women are more likely to take overdose of drugs or poison. 17% of patients with depression and 10% of schizophrenics die of suicide. Now, what are the red flags or the warning signals of suicide? When someone is talking about suicide, I wish I was dead, or I wish I was not born. Getting means to end one's own life, like buying pills, stocking pills, withdrawing from people suddenly, isolated behavior, mood swings, ideas of hopelessness, helplessness, increased consumption of drugs and alcohol. When someone is giving away belongings, making a will, saying bye to people, one should suspect suicide. If feeling suicidal, what are the things that one should do? One should reach out to a close friend or a loved one. One should talk out their feelings to them, that is, ventilate. You can contact your spiritual leader. Suicide hotlines are available, which you can call up. You can book a session with your counselor or a psychiatrist. Suicidal thinking doesn't get well on its own. So please ask for help. What is the prevention and treatment of suicide? First of all, early detection and treatment of depression and anxiety with antidepressant and anti-anxiety drugs is mandatory. We should promote positive health and instill good coping skills in our children. We should increase awareness among parents, teachers, and counselors about child rearing practices and early intervention of mental health illnesses. We should build support systems with peers, teachers, parents, and counselors. At the community level, we should establish social and family support programs. We should help our children find a purpose in life. We should address issues related to gender inequality, physical and domestic and sexual violence. Providing simple tools of coping like yoga, exercise, mindfulness therapy, and meditation calms the mind. Schools should employ mental health counselors to tackle every child's mental health problems. Teachers should create an environment where distress, depression, and thoughts of self-harm are reported. Early detection and treatment of drug and alcohol abuse is a must. There is a crucial role played by the law by restricting the availability of firearms and drugs. The role of the press and social media in creating awareness about mental health issues is also very important. Excessive use of social media is related to poor sleep quality, depression, suicidal thoughts, and altered brain development. Students who have gadget addiction like gaming, watching porn, suffer from depression, overthinking, shy nature, lack of purpose, academic problem, difficult parents, and need immediate psychiatrist help. Attention deficit hyperactivity disorder, conduct disorder, eating disorders like anorexia nervosa, bulimia nervosa are quite seen in our current children. Adolescent depression and anxiety, obsessive compulsive disorder also need immediate psychiatric intervention. So friends, to conclude, we should all follow the best rule of life, which says B stands for breathe well, E stands for eat well, S stands for sleep well. And if you do all these three, that you breathe well, eat well, sleep well, automatically you will think well. Thank you, friends.